but we can see it with cirrhosis and with liver failure. There's two other things that we use to assess your gallbladder or your biliary tree health, and that is your GGT, which is your gamma glutamyl transpeptidase, and that's another enzyme that is associated with the biliary system. And like I said, elevations in that, usually you got to think gallbladder disease or disease of the liver that's affecting the biliary tree or bile formation. Excessive stress can sometimes also cause the GGT to be increased. Your bilirubin is another substance that we can monitor that helps tell us about the liver. Bilirubin is actually a breakdown product of hemoglobin, and if you remember back from the CBC portion, hemoglobin is carried by red blood cells. So normally bilirubin circulates in the blood, and it circulates as what's called conjugated and unconjugated bilirubin. And increases in conjugated bilirubin are generally due to liver disease. And increases in unconjugated bilirubin are usually due to anemia caused by the breakdown of hemoglobin. So when we think back about like the IMHA we talked about, so the red blood cells are lysed and they open their contents, and one of the contents is bilirubin as the hemoglobin breaks down. But because your liver is a filter, it should be filtering that bilirubin. So if there's no anemia, but your liver's not working well to filter, and or there is an overflow of bile, right, due to either gallbladder disease or liver disease, you'll then see that bilirubin start to creep up. And bilirubin is actually a evaluation of liver function in the sense that if it's high, you know that the liver is not functioning correctly. AST is another one, and that is aspartate transaminase, and it's found in the liver as well as skeletal muscle. So elevations in AST that occur with elevations in all the other liver enzymes usually suggest it's liver in origin, but if all the other liver enzymes are normal and the AST is elevated, sometimes it's actually due to muscle damage. We talked earlier about the BUN can be affected by the liver. Albumin is made by the liver, so if the liver is not working at all, then that will drop. Cholesterol is produced by the liver in the same kind of concept, because cholesterol is produced by the liver and then excreted in the bile, so basically we poop it out. So if there's gallbladder disease, you might see the cholesterol creeping up, but if there's liver failure or cirrhosis, you're going to see that serum cholesterol drop. There are two main proteins in the blood. There is albumin and globulin, and they comprise what's called the total protein level. Albumin, which is produced by the liver, requires adequate dietary protein in order to be synthesized. And it has a lot of jobs. It's a big, thick protein, so it actually helps keep the liquid part of the blood in the vessels. It helps create a pressure gradient so that that liquid, your blood, stays in there, and if the albumin is too low, then that liquid portion can actually leak out and you can get edema, which is swelling either in the soft tissues, so when you think about people, they get swelling of their feet or edema of their feet, or you can get it into the belly, or you can get it into the chest cavity. It's also a carrier for many substances, like metals, ions, fatty acids, amino acids, bilirubin, bile acids, hormones, and drugs. And it carries them throughout the whole body. And it's actually a free radical scavenger, so it helps reduce inflammation, and it also helps with clotting. Elevations in albumin are really only due to dehydration. And decreases, called hypoalbuminemia, can be due to complete anorexia, so not eating, if you have a diet that is deficient in protein, if you have certain types of gut disease that allow protein to leak out basically into the poop, and those are called protein-losing enteropathies, or PLEs, and those actually result in both the albumin and the globulin being low. Protein-losing nephropathy, which is a specific type of kidney disease, can result in low albumin, but it does not affect the globulin levels. Prolonged bleeding can cause low albumin. Unhealing wounds, so like chronic, oozy, weepy wounds, you're actually leaking out albumin, so it's going to drop. Liver failure, as we talked about before, pancreatitis, pneumonia, and sepsis, so complete infection throughout the body. Your globulins are proteins that are also made in the liver by the immune system, and they help with liver function, clotting, and they aid the immune system in functioning. Hyperglobulinemia, so elevated globulin levels, can be seen with chronic inflammation or infection, cancers, dehydration, and certain drugs, especially steroids. Hypoglobulinemia, as we talked about before, can be due to those PLEs or protein-losing enteropathies, but also pretty prolonged chronic inflammation and infection can kind of go the other way and cause the globulins to drop. On to the gut and pancreas. So the values we look at that help us kind of tell gut and pancreas health are glucose, albumin and globulin, your amylase, which is an enzyme that's secreted by the pancreas and the small intestine. And you can see elevations due to pancreatic inflammation, small intestinal inflammation, or even just generalized inflammation within the abdominal cavity. Lipase is another enzyme that's secreted into the small intestine during digestion. And it can be elevated after meals with pancreatitis, severe gut inflammation, if they're lipemic. So we talked about that way back at the beginning, 20 minutes ago. And kidney failure. Cholesterol we actually can use to help tell us about gut health. And cholesterol is produced in the liver, excreted in the bile, right? So pooped out. And cholesterol by itself is not a diagnostic test, but it helps us kind of put things in perspective. So high cholesterol or hypercholesterolemia, and keep in mind, we don't do a lot of we don't really test for like LDL, HDL like we do in people. So cholesterol can be high after you eat. It can be high with gallbladder disease, if your thyroid's low, if you have Cushing's disease or hyperadrenocorticism, which is basically the opposite of Addison. So they secrete too much stress hormone. Acute kidney disease, a specific form of kidney disease called nephrotic syndrome, which results in losing protein in the urine, a low albumin, high cholesterol, and then you get swelling of the legs or the edema like we talked about. And lipid disorders, which are common in like schnauzers and shelties, can also cause it. Decreased cholesterol or hypocholesterolemia is usually due to liver failure, cirrhosis, diabetes, or anorexia. On to the muscles. So we talked about earlier, your AST is an enzyme that is found in high levels in the liver and the muscle. So it can be elevated if there's actual skeletal muscle damage. And your CK or your creatinine phosphokinase is an enzyme found in the central nervous system and skeletal muscle. And so it can be elevated if there's muscle trauma. It can be elevated if there's inflammation in the muscles, if there's severe muscle wasting, some forms of central nervous system damage. But it can also be elevated if we have a traumatic blood stick, like we talked about earlier. So if you have hemolysis, sometimes you'll see a corresponding CK elevation. A CK or creatinine phosphokinase elevation secondary to muscle disease is usually way higher than one that is due to like traumatic blood stick or hemolysis. Your electrolytes, the ones that we primarily care about, are sodium and potassium. Your sodium is dependent on the amount of water that you take in versus the amount that's excreted. And your brain is actually really affected by your levels of sodium. So too much and versus too little, like you can get swelling or shrinking. So high sodium or hypernatremia can be dehydration, heat stroke, fever, seizures, severe vomiting and diarrhea, pancreatitis, severe skin burns, salt ingestion. And we see that in dogs usually like if they eat Play-Doh, paintballs, or really, really high salt water, or like they get hold of like those salt licks for deer. And then you can also see it with Cushing's disease. Low salt or hyponatremia, vomiting and diarrhea, Addison's, right? So the opposite of Cushing's. Kidney disease, skin burns. There's this thing called psychogenic polydipsia. Polydipsia just means increased thirst. And it's a diagnosis of exclusion, so you have to rule out every other cause. And it's basically like they have, and for whatever reason, they've convinced themselves that they have to drink an excessive amount of water. Hypothyroidism or low thyroid, heart failure, liver failure, water toxicity, right? So actually drinking too much water, and diabetes can all cause low sodium. Potassium is primarily affected by you peeing it out, as well as when it moves into and out of the cells. And high potassium is called hyperkalemia. One of the reasons for that is Addison's disease. And in Addison's disease, you will see a high potassium and a low sodium. And there's something called the sodium-potassium ratio, which honestly we really only care about for patients with Addison's or when we're trying to figure out if they have it. And a sodium-potassium ratio of 27-1, right? So 27 sodiums for every 1 potassium, or anything lower than that, is very suspicious for Addison's disease, but then you have to do additional testing. If you have urethral obstruction, so you can't pee, then your potassium is going to start to go up. A ruptured bladder, severe kidney disease, salmonella, whipworms, perforated small intestinal ulcer, bloat where the stomach actually torses, pancreatitis, DKA, or diabetic ketoacidosis, which is a severe and potentially fatal form of diabetes. Or it's really actually an end result of poorly regulated diabetes. Surgery can sometimes cause high potassium, crushing injuries, severe infections, aortic clot, so a thromboembolism, heat stroke, prolonged exercise, certain medications. You can have pseudo-hypokalemia, which occurs if the blood is drawn and then it clots for a really long period of time in the tube. And so you can sometimes see that with the low blood sugar that is also fake or artificial. We call it iatrogenic. Like if we cause it, aka we screw up, we call it iatrogenic. Breed-associated pseudohypokalemia is also a thing. So Akitas, Shiba Inus, and Shar-Peis tend to have higher potassiums. Low potassium, you can see it with chronic kidney disease if you have reduced potassium intake, and if you get potassium-free or low potassium IV fluids. So if you're put on IV fluids, they sometimes have certain amounts of potassium in it, but not a lot. So if they're on fluids for prolonged periods of time and you don't add it, then you can wash them out. If they eat clay cat litter, which I thought was interesting, insulin administration can cause potassium to drop, as well as hyperthyroidism or high thyroid levels in cats. Vomiting and diarrhea, and if you use diuretics or like water pills, that can also cause a low potassium. Our last topic is our calcium and phosphorus. And calcium and phosphorus are talked about together because they're fairly closely regulated. Total calcium is what we typically measure when we're running routine blood tests. But the ionized calcium is actually the active form, but it requires special testing and it's more expensive, so we don't routinely do it. So there's hormones that regulate calcium. There is the parathyroid hormone, which is released by the parathyroid gland, which lives next to the thyroid gland, so in your neck area. And when the calcium in the blood drops, parathyroid increases, and it will then cause calcium to increase by increasing reabsorption from the bone, right? So like almost sucking it out of the bone, as well as increasing absorption from the gut and the kidneys. So it doesn't let the kidneys pee, doesn't let you pee it out through the kidneys, and it helps the gut absorb more from the food. Calcitriol, aka vitamin D, increases calcium in the blood because it increases the absorption through the gut, so you through the food. Calcitonin is a hormone produced by the thyroid gland, and it prevents calcium reabsorption from the bone and absorption from the kidneys. So it's actually going to drop the calcium levels. High calcium levels can cause a whole bunch of problems. So it can contribute to kidney disease and even failure. It can cause constipation, reduced appetite, and stomach ulcers. It can also cause weakness, muscle wasting, muscle twitching, and it can make you tired, thirsty, got to pee a lot. And you can also get calcification of the soft tissues, and it can lead to heart problems, generally through calcification of the heart. So the reason that we have high calcium can be what's called idiopathic hypercalcemia. So idiopathic basically means we don't know why it happens. And I was told in vet school that it means that the clinician is an idiot and the pathologist is pathetic. So idiopathic hypercalcemia in cats can happen, and cats are aliens, and so we just don't know why it happens. But you have to rule everything else out before you can say that it's idiopathic. Hypercalcemia of malignancy is basically a fancy way of saying cancers can cause high calcium. Not all cancers, but some. Primary hyperparathyroidism, so an increased secretion of parathyroid hormone from your parathyroid gland. Increased intake. Diseases that cause significant bone destruction, kidney failure, vitamin D toxicity, and fungal infections can all potentially cause high calcium. Low calcium or hypocalcemia, vitamin D deficiency, rickets, calcium deficient diets, low parathyroid hormone, so hypoparathyroidism, eclampsia, low albumin, pancreatitis, and then certain disorders of the gut where you don't absorb the nutrient. And then there's something called nutritional hyperparathyroidism, which is, again, like nutritional deficiencies. Certain kidney diseases, sepsis, so like severe infection throughout the body. Ethylene glycol toxicity, so ethylene glycol is antifreeze. And there's a lot of other severe issues it can cause aside from low calcium. But it's one of those things we got to think about. Last one, phosphorus. And we usually, like I said, compare it to calcium. And 85% of the phosphorus in your body is found within your bones. 14% is in the cells, and then 1% is actually measurable in the serum. And it's absorbed by the small intestine and excreted by the kidneys. And kidney function and hormones help regulate how much you pee out, basically. And it's also regulated with calcium by the parathyroid hormone, calcitriol and calcitonin. So parathyroid hormone increases calcium, decreases phosphorus. Calcitriol increases phosphorus, decreases calcium. It has a few roles in the body, so it maintains structure and health of teeth and bone.